Hi again. I'm Dr. Anshuman Manaswi, reconstructive surgeon, LaTransformatione, Mumbai. Today we are talking about diabetic foot. Welcome again to the educational series. We all know that diabetes is a silent killer. And the more you control your blood sugar, the better it is for you. Because diabetes can affect each and every system of the body. The diabetes affects heart, kidney, eyes, nerves, and the blood supply in general. So today we are going to talk about the foot problems because of diabetes. Diabetes can give rise to what is called as neuropathy, where the nerves are degenerating, mostly because of the blood supply to the nerves becomes little less, and also the damage to the blood supply in general to the skin gives rise to what is called as diabetic ulcers. The combination of nerve damage and the blood supply are in most cases responsible for diabetic ulcers. But the diabetic neuropathy or the nerve damage will give rise to decreased sensation in the nerves of your foot. So you would feel as if the sensation in the sole is less. Such a case, you must see a neurologist who would see you and give you treatment to help the nerve regeneration as well as to control the diabetes. There is one more place where plastic surgeons come into play in diabetic neuropathy. That is why I'm here to talk about it, and that is where the microneural release of the nerves can be done by microsurgical techniques by a plastic surgeon. What it means, basically, there are 2 or 3 nerves in the leg which supply the sensation. So specific nerves can be made free. It is like a compartment because of the lack of blood supply to the nerves. There is a thick covering on top of the nerves which occur, because of which the blood supply to the nerves becomes further compromised. So we can release those nerves and make them free so that they can breathe easily. And many a times they give very good result in restoring the sensation of the foot. The other problem which the diabetes people can have is diabetic ulcers or wounds. Now please remember, whenever the sensation is less, we don't feel and we ignore certain injuries because we have not felt it. So in such a condition, if there is a small injury which goes neglected because you have not seen it, it can become big. It can become infected, especially in the foot, because foot is exposed to so much of dirty environment, whether we are walking, even though we are walking in our homes or anywhere, but still there is a dirt somewhere. Microorganisms are there. So the most important lesson for diabetic people is foot care. One must examine every day the foot, the sole of the foot, the web spaces of the foot. Take a mirror and see every day, fix up a time and listen to see in the mirror and check whether there is any small scratch or boil or an ulcer. You can even ask your family members to look at them. If you are not able to, reach them. But it is important that the foot must be inspected every day. Make it a habit, like brushing your teeth. That will go a long way in preventing the diabetic ulcers. Now what happens is that a small ulcer, small wound like that, which goes neglected, it increases, and also increases because there's a constant pressure because of walking and all that. Improper footwear can also give rise to wounds because some small thing, point of irritation can go neglected. So proper footwear will also go a long way in helping you. So once a small wound has happened, it increases because you have not seen it, and there is a constant pressure because of walking, and that wound further has less blood supply because when you walk, the blood vessels become compressed. Already blood vessels are compromised, they have less blood supply, so the threshold is breached. And in such a case, the wound becomes bigger, then it becomes infected, and then there is a destruction which silently happens because there are no sensations, so you are unaware. And that infection gradually increases and goes on to the tendons, the nerves, and the coverings on the muscles and all those things which are inside the foot. The foot is a thick layer, and the infection keeps on spreading inside. And it is important to understand that what is visible from the top can only be the tip of iceberg. The infection may have gone silently inside. And that is where it is very important to address the issue very, very seriously, because neglected cases can give rise to amputations. When you reach a plastic surgeon for a diabetic foot, the first thing which is done is the assessment of the wound, whether it is superficial or whether it is deep. If it is deep, what is the depth and how much would the damage inside be, assessment of that. If the wound is superficial, is the best scenario. In that case, just a little bit of rest may heal the wound, with diabetes control, of course. But if there is a deep wound, then it requires a lot of attention. Some surgeries may be required, sometimes one surgery, sometimes two surgeries. That depends really on how much is the infection and how much of the damage is there to the surrounding tissue. Because infections do not heal very easily because of diabetes as well as because of low blood supply. The low vascularity means that less oxygenation of the part, and that means that the infections take time to settle. So, as I told you in my last interaction with you, a process called debridement is followed, which can be enzymatic debridement by some ointments for very, very less infection, very, very less necrotic tissue. But in majority of the cases, a surgical debridement or removal of dirty tissues or removal of necrotic tissue or removal of debris is done. That cleans the wound, and once the necrotic tissue, the infection and all is taken out, the wound heals faster. This, coupled with the rest and antibiotics and other clean dressings, will improve your wound so that the wound coverage can be thought of. And that wound coverage can happen by itself, by self-healing, or it can happen by an operation. If it is a small wound, it can be stitched together. The large wound, then some sort of reconstructive procedure may be required. Reconstructive procedures take time. Sometimes they may take 10 days, 12 days. Sometimes, if you are lucky, You can get away with what is called a skin graft, but many a times a flap is required, which is, again, as I told you, this is the thick skin borrowed from the surrounding area or from a distant area along with their blood supply and restored at that place through microvascular surgery will give rise to a proper tissue or at that ulcer. That would mean that a good tissue coverage is achieved, which in case of deep wound, chronic wound, would lead to a good healing. But remember, once the surgery is done, that is not the end of the game. Diabetics require lifelong care of their foot, even if a flap or a skin graft or anything is done. Because again, the same process of neglect of a small wound can follow. So diabetic foot care is very, very important, and simple things, you don't require anything great. Simple things is that observation of your foot, cleaning every night, making the web spaces dry, and wearing proper footwear with good support, silicone support or a sponge support will prevent you from having a diabetic foot ulcer. If you have had an ulcer, please see a cardiac specialist. Please see a plastic surgeon who can take a holistic view about diabetic problems, so that many a times your amputation can be avoided, and that will be the best scenario for you. I hope you like this informative video and educational video. Hope you are liking the series. Till then, goodbye. Take care of your foot, my dear fellow diabetic people. Please do not get depressed. There's always a hope, but never lose out on cleaning your foot. Thank you so much.